Hi, my name is Jenny, and I am a PhD researcher at CHEO. I'm joined today by Dr. Roger Zemek. Dr. Zemek is a pediatric emergency physician in the CHEO emergency room. He's also a concussion specialist at 360 Concussion Care and the Canadian Care for Concussion at the CHEO-RI and the University of Ottawa. Together, we're going to talk about some updates to concussion clinical care. A big part of the work we do at CHEO is making sure that the research evidence gets into practice. We do this by developing a pediatric clinical concussion guideline. The project is called Peds Concussion. And I encourage you to use your phone and check this out to learn more about the new updates and tools for coaches, teachers, parents, and youth who have been diagnosed or have a suspected concussion. Today, we're going to talk about the top 5 questions that were asked about managing concussion. The first question that we hear a lot of is rest and recovery. Is it important to rest at home until you feel better after being diagnosed with a concussion, Dr. Zemek?
It's a great question, and one that's probably changed the most in the guidelines over the last 10 years that we've been working on this. Initially, we thought more rest is better, but we were wrong. We now know that it's really important within 2 days, ideally, to get back to your life, be it school or work. And these are important for kids and others to get contact back with their social networks, as well as to reintegrate as tolerated as much as they can on their day. That's why sometimes accommodations are needed. So in summary, it's okay if there are still some symptoms while people are at school. I was always told by other concussion experts when they give their talks, quote, "Doing homework does not cause brain damage," and that's the case. So it's okay if a little bit of thinking does bring on the symptoms as long as it can be tolerated. It's also important to not miss too long. Missing more than 1 week of school may actually be harmful for prolonged recovery. While you're at school, it's important to do things that don't cause re-injury. So while you may be allowed to go back to doing some physical education classes, and such as a little bit of walking or running, doing a game where it's going to lead to full body contact or risk of falling are not allowed until you're cleared by a doctor. And speaking of which, while clearance for sports, especially for contact, does require a doctor's note, a doctor's note is not required to get back to the classroom, especially since we want people back to class within 1 to 2 days after their injury.
Thanks, Dr. Zemek. A second big question that we see a lot is, what role does physical activity have in recovery? And when is it safe to start doing some physical activities? Dr. Zemek.
So we know that exercise is a medicine. It has been shown in many research studies that doing physical activity within a couple days of injury has resulted in faster time to recovery. So let me summarize some big physical activity recommendations. First, we no longer recommend complete rest until people are completely symptom-free. After 2 days, people can start doing some low-risk physical activities, assuming they're not going to fall again. It's also okay when you do these physical activities if a little bit of symptoms come on. As long as it's tolerated, people should continue to do it. These exercises can sometimes be supervised in a medical clinic where they can figure out the Goldilocks heart rate for people to get back and optimize their return. This is especially helpful in athletes. Doing too much may actually cause a lot of symptoms, but doing too little is not enough exercise to promote the recovery, because it does actually help cure what the common causes of the concussion physiologically. Lastly, any return to contact sports or full competitions where there's collisions does require medical clearance by a doctor.
Thanks, Dr. Zemek. What about specialists? when should we be going back to our family doctors or our drop-in clinics and asking for specialized care?
Thanks, Jenny. It's a great question. One of the studies that I had the pleasure of leading was a study called the 5P study, where we had 3,000 children across 9 emergency departments in Canada, and we followed them for several months following their acute injury. We found that we were able to identify those who were higher risk of having prolonged symptoms. That's called the 5P score. And if you've not heard of this before, you could either get it on the guidelines or you could even go to the 5P concussion website. Providers can look at that score and identify anyone who's high risk to be seen at the first visit, refer them right away. Ideally, research has shown children and young adults who are seen at a specialty interdisciplinary concussion clinic within the first week of injury do a lot better than those that are seen later on in their injury course. If you hadn't identified them early and they're adolescent is having symptoms at beyond 2 weeks, those children should be referred as well to a medical specialty clinic for concussion. Finally, as I was talking earlier about the exercises medicine, for those athletes who really want to optimize their return and figure out what their ideal heart rate is to optimize and time their activities, going to a specialty clinic can sometimes offer this higher level supervision to help athletes return to their sports as safely and as quickly as possible.
Thanks, Dr. Zemek. The fourth question has to do with screen time. We all know that screen devices are an integral part of our lives. A question we commonly get asked is, what effect does using these screens have on recovery of concussion? And when is it safe to resume using them? Dr. Zemek.
So Jenny, it's a great question. We know a little bit more than we knew a few years ago. We still don't have all the answers yet. From what we can tell, it's like most things in life, it's like Goldilocks. Similar to the school and similar to the exercise, you don't want to be doing too much. And I also don't want to say 100% zero because I know it is important for kids to use this as a communication tool with their friends. In general, I recommend avoid it in the first few days when their eyes are really adjusting, because eye changes are very common in concussion. But gradually resumption of use is okay as long as symptoms are tolerated. For those kids who are using it hours a day, the evidence does show those kids do work. Finally, this is important for school because there's a lot of sometimes screens at school. For kids with concussions who are having challenges with screen times, this is where a clinic can work with a school to come up with special accommodations tailored for that child's need. For example, using things on paper, more time for assignments, or breaks throughout the day.
Thanks, Dr. Zemek. The last question is on the top of many of our minds and in the media. What about mental health? We know that anxiety and depression is quite common. What roles do these have in recovery from concussion and also for those that have pre-existing conditions?
It's a great question, Jenny. And exactly like you mentioned, there's so much overlap with mental health and concussion. We don't know sometimes whether it's chicken or sometimes or it's egg. And we know that there are sometimes people who have pre-existing emotional changes can become a lot worse with concussion. People who never had emotional changes can suddenly get them after their first concussion. In short, it's important to recognize and assess these early and start treatment to prevent ongoing mental health symptoms. Some of the treatments that have been shown to be effective are things like mindfulness, exercise, counseling, and even if it doesn't require counseling, speaking with trusted people. For those who have more worrisome emotional symptoms, referring them to an interdisciplinary team to get some more specialized mental health supports is a really important step to identify early to prevent any sort of long-term problems with this.
Thanks, Dr. Zemek. In summary, we encourage you to take time and look at the website where we keep all of these clinical recommendations. There are also tools on this website for teachers, coaches, athletes, youth, and also parents. Dr. Zemek, do you have any closing words for us today?
Good news is most people get better from a concussion in a short period of time. It's important to do all these optimizations to make sure all the people who do have concussion can get back to work, life, sports, and the things they love doing as quickly as possible, but also as safely as possible.